Maintaining your dental implant is very important. Your hygiene has to be as good as or better than your natural teeth, because if you don't maintain that dental implant, you will lose bone around it and you'll lose the dental implant. Let's talk about toothbrush type first. We like you to use a soft toothbrush. A soft toothbrush is ideal for cleaning the tooth surface and the rim or the margin of the dental implant, which is even with the gum tissue. We don't want you to use an electric toothbrush. An electric toothbrush that's a rotary brush is very caustic or hard on the tooth surface and transmits a vibration down to the dental implant. An electric brush that's a sonic type brush that provides cleaning by ultrasound is a no-no as well. When the implant is integrating into the bone, it's thought that anecdotally that the bone cells are disturbed by that vibration in attaching to the bone implant interface or the titanium surface of the bone. So the best thing to maintain your implant with is a soft toothbrush and those small bristle brushes called proxa brushes to go between the adjacent teeth.